we have a Facebook page called Veterinary Anesthesia Nerds. Anything you want to know is on there. Did you?
Yeah.
That's our group. Lot of conversations, a lot of pre-med conversations. There's a lot of DVMs on there asking, questions about things that they're seeing. Technicians, a lot of technicians on there. If you're interested in derm, we have a derm one. If you're interested in dentals, we have a dental one. We have used equipment pages. Anything you can think of. I know it sounds cheesy. It's all on Facebook. Okay. All right. We're gonna talk about monitoring a little bit.
Did everybody get
Great
the
monitor purchase, Doc.
What's that?
Great monitor purchase.
Everybody got the thing that Jackie sent
I
out
was gonna
about
say,
monitoring?
we probably called you and said, what do you
Yeah.
thought?
These are the best ones. Yeah. These are the best
Usually
ones.
when Steph says we need a monitor, I'm like, well, call Bryce, or almost anything.
These are the
But
best
women,
ones.
Call Bryce, figure out which one to get.
So a little trick with these. Before you turn them on, everything has to be plugged in, or else you're not going to get proper readings. Okay? So everything, all the way down to the temperature sensors. So we're going to talk about CO2 a little bit as it really pertains to anesthetics. So, did everybody use this before? Okay. All that this is a camera. That's all it is. It's an infrared camera. So it's constantly taking a picture, right? There's two types of CO2 sensors. There's mainstream, which is a camera, connects directly to the trach and the breathing circuit this way. Then you have side stream. Side stream is not a camera, it's a little tube that either comes from the monitor, a clear tube, comes from the monitor that has a little clear adapter that goes between the trach and the breathing circuit, or there will be like a plug with a little box, and the little box will have a tube that goes to the trachea and the breathing circuit, okay?
And we have both of the.
You have both?
Yeah. You guys have seen the clear one, right? I think it's in
The clear
super-
tube?
It has like a little coil on it.
Yeah, like a braided line?
Yeah.
Okay. These ones are more accurate. They're giving you real-time data. The side stream ones, they have a pump in the monitor that sucks a sample through, and it has to run all the way through that line. So it's not exactly real time, there's a slight delay. The downside with the side stream ones as well, you have condensation. Condensation, if it runs back to electronics, can create a little bit of a problem, right? So these are the most accurate mainstream. This one's called a Capnostat 5, really common. You'll see these in a lot of different monitors. You have different adapters. Are you guys familiar with the adapters and why there's different ones? Okay. So the purple clear ones are for anything 4.5 and under in regards to trach tube sizes, over 4.5. You can use this on any patient. You cannot use this on larger patients. If we look at the volume, I know you're recording for your friends up in Connecticut. Big difference in volume, right? Huge difference, right? It's like breathing through a straw. Whenever you set this up, your adapter needs to be in place before you turn the monitor on. You want to inspect the adapter. If we look at this, there's little windows, right? So the window, it's just giving the camera a little area to take a picture from. If the window's dirty, we got to clean it. Q-tip, water, no alcohol. Alcohol eats plastic, it dries it out and it will crack. That's why you've got cracks on here. See that crack?
That reminds me of something else we need to talk about with alcohol when we get to that part.
These are single use, one time. That's how they're designed. Keep a backup in a bag of each one, because if it cracks, you're not gonna be able to use it, you're not gonna get proper readings. You can usually get about 30 to 40 uses out of them before they create a problem. But you wanna always hold them up to the light, close one eye. I usually will move it around so that I can see the debris, if you guys wanna have a look at that. This one's really dirty, but if you close one of your eyes, hold it up to the light, and then move it to the panel where there's no light, you can really see the debris in there.
Do we have these for each monitor? I'm asking you guys.
What, the capnograph?
Yeah.
We've
Or is
got-
it
we've
just,
got one.
there's this one and then there's a one
We
that's
only
in.
have one.
There's
now.
two. There's two. No, there's not.
No,
one.
there's just one.
There's the one with the
There's-
braided line.
That's the side stream one.
Yeah.
Yep.
I'm pretty sure we have one of each.
Did you wanna see this
one?
one?
I was pretty sure we had one. I can't be remembering, of course, it was, my brain's so bad.
You can also take a Q-tip and some water and clean off the lenses. It literally is a camera, no exaggeration. It's a camera. Depending on the monitor, you have to buy these, just so you guys know if you're ever in a position where you're buying them. You have to buy them from the manufacturer of the monitor. They're coded differently. So at Banfield, you guys have Bionet monitors, but you're using these. If you take one from Bionet, it's not gonna work on this, even though they're $1,500 cheaper. They don't work, okay? It has to come from the manufacturer, just so you guys are aware. A lot of people aren't familiar with that, okay? Now, remember how we talked about when I plug it in, I have to have everything inserted? What if it's not, right? So because we're gonna change it in between patients depending on their size, right? If you guys look on here, there's a little arrow. You guys know about the arrow? Okay. If you guys know. It doesn't matter.
It doesn't matter.
Doesn't
Okay.
matter. Okay. So if you plug it in and turn it on, your adapter's not in there, we have to zero it out. So this is all touchscreen. We can touch CO2 and then start zero. And what it's starting to do is it's taking a room air sample. We have roughly 400 to 600 parts per million of CO2 in our room, and it's zeroing itself out. If we don't zero it out, we don't know about our accuracy. If you have it plugged in and you turn the monitor on, it automatically zeros, okay? If you have it on and you go back and forth between different sizes, you have to go in there and zero it out, okay? Very, very simple. You're gonna see how we have zero success? We're good, now we can move forward. Did I alter this? I did, okay. So I've already altered this machine. Dr. Garrett, I don't know if you're aware of this, but I've changed some things on it. So we installed what's called cataloging on the machine. So your CO2 waveform will be here. If you touch your trends, it will allow you to toggle between all the different waveforms with CO2, and it will tell you what's happening with your patient. Have you guys seen this before? No? You can just toggle, and when you get to the end, it'll take you back to your main screen, okay? This sensor, this little adapter, is the #1 cause of problems. Always have a backup, okay? Questions on this? This is pretty simple. This is $3,000.
Don't drop it.
$3,000. Stephanie will kill you.
Don't let
Okay.
anybody step on.
Put it in perspective. This costs more than this whole machine.
I do have a
Okay.
question.
Yep.
Well, wrapping up that cord, two finger,
Yes, you don't want to wrap any cords up,
Yeah.
okay? Well, while we're on monitors. So you can wrap up your blood pressure tubing, not gonna hurt anything, there's no electricity that runs through there. But you don't want to wrap anything that has circuitry in it, right? So your pulse ox, if you wrap that too tightly, you're just kinking the wires inside and they're not gonna get a good signal. With pulse ox, where's your pulse ox? With pulse ox, because you guys have so many monitors, what I would recommend doing is naming each one. So you guys can come up with whatever names you want, maybe do like a raffle system or whatever you want to do. I've seen weird names. I've seen Kim Kardashian. I've
please
seen
don't do that.
Kanye West. I've seen all kinds of stuff. So we'll call this one the Florida Panthers. They're doing great. Okay, so this one's a Florida Panther monitor. Grab a label maker. This is probably going to be you. Label this Florida Panthers, all the sensors. That way, if you ever have a problem, you can take Florida Panther sensors and move it over to Miami Dolphins monitor and rule out what the problem is, right? With the pulse ox, this is an actual strobe, but you can't see it. Your eye can't differentiate between the flashes. So if you're seeing any flashes or color change, something's going on with your sensor, okay? This is two pieces. How would you know if it's the sensor or the extension cord? If you replace both of them, they're gonna be like $500, right? The sensor's probably 200, the extension's probably another 260 or something like that. But rule it out, right? That's all you gotta do. But what I usually try to tell people to do is, and you guys can do it, get some nails, put them on the wall. When you're done, lay them on the wall or clip them vertical, but don't wrap them, okay? Pretty simple, right?
The other one you guys have to be really careful with, it doesn't relate to the anesthesia machine, but it does relate to surgery, is the cautery.
Yes.
That
Someone did that the other
cannot
day.
be, oh no, it's been like that, like every time we've gone into surgery and it's not, the machine is very finicky and it's not been working properly, so that cannot be bent over and twisted like that.
Yeah, cautery ground, you're talking about grounding plate cords?
Yes.
Yeah. So grounding plate cords go bad very, very easily. The way that it works is if there's a kink in the line, The electricity can't travel through. When you hit the pen or whatever you're using, it's not gonna complete the circuit, and you're just getting a static shock, a micro shock.
It's gonna beep and then we're
I
gonna
would
use our
have
big girl
extra
words.
gravity brake for you. You do? Okay.
Yeah, and the big thing is like when you guys are done with anesthesia, usually setting everything up, people are fairly general. You're done with the equipment and you're always in a rush to move the animal. That's when everything just gets disconnected and drop. And that's exactly it. You're dropping a $3,000 sensor, you're dropping a $500 sensor.
Yep.
That'd be really good.
Yep.
And honestly, we can send out an email, but if you drop something or break something, they're leaving it, you say something, you're not gonna be in trouble. We get upset when you don't
Yeah.
say something and then we're left to find it because at times then we can't.
You're not gonna be
we have a
successful
procedure
the
that we
next
need-
day.
Yeah, we
Yeah.
need something like it's gonna create problems for that next person or the next patient, so just be mindful, we're always very open to someone admitting to the mistakes and us having to find it always get right.
Was it something about people use that word?
We had multiple $12,000 dental sensors chewed on, we never charged that for it. You guys are seeing.
Very, very common to have those chewed on.
Well, call when you're not paying attention.
Do we know about eye reflexes? We didn't even talk about gum
I was gonna get
colors.
into that, but
Okay,
that's not the
okay.
one, but how to
Okay,
level
I'll let you get
anesthesia
into
and
that.
stuff.
You guys don't have it, but while we're having this conversation, a lot of monitors have esophageal EKG. Are you guys familiar with that? Have you guys seen that? No? You have? Okay, so it's like a obnoxiously large probe that you shove down their esophagus.
You can't use it.
Yeah,
with
correct.
cautery.
Yeah.
You can't use it with cautery, right?
Yeah, that's what we're getting at. So if you're ever in a facility and you've got cautery and an esophageal EKG, stop the program. You cannot use esophageal EKG and a cautery at the same time. You will burn a hole through the esophagus from the plate directly to that sensor. You're just gonna burn it, and it's not a pretty sight. I've seen it, so just be aware of that. As far as a monitor, the temperature probe down the throat, it's more of a rectal probe, but it's not gonna hurt anything with cautery. But the only other thing there's a couple other things I wanna show you on here. Remember we showed you the cataloging with the CO2 waveforms? Who knows how to read PQRST waveforms? I know you do. No? Okay. A lot of people don't. It's kind of difficult to understand unless you spend hours and hours really learning it. But we've set this monitor up where if you hit display one time, it will bring up all of your PQRST waveforms and it will tell you the arrhythmia, right? So you can actually train yourself and match it up with your patient's waveform above it and just toggle through all of them and teach yourself. The big one is the R wave, all right? Start there. I'm not teaching that. I would love to, but
I'm pretty
that's
sure
too much.
You mentioned before that there's a website that you can go to.
You can go on you can go on YouTube if you want to. There's tons of videos that will teach you everything in regards to the heart and waveforms and exactly how they work and timing and scrolling.
If you guys are interested, let me know what you want, and I can try to like simplify that and send you, or I can try to look for something that simplifies it. So the most important thing is you should know all the variations of normal,
Yeah.
so that you just know when it's not normal. Because if you tell one of us this doesn't look right, that's what I want to know. I want to know when it doesn't look right, because then I can help you figure out what's going on. So.
I would focus on bradycardia and tachycardia first, and then move your way into other waveforms. If you want to get rid of this on the screen, all you do is hit display, and it'll cycle through all the different displays. So if you don't want to see any waveforms and you just want numbers, you can go there, and then you just cycle through all the way around. The machine also has a Sotasorb reminder. Based on the hours it's running, it will tell you to change the Sotasorb. It also has a technician checklist. I know Dan's created a checklist for you guys. It also has it built into here. It's not turned on at the moment. We're gonna let you guys decide if you want to do that, but you can customize it. You can put your initials in there. It'll save it all. With this particular monitor, do you guys change the species from dog to cat? You do? Great. Okay. Pretty simple. That's pretty much it in regards to the monitor. Do you guys have any questions? Do we use alcohol on our EKG clips? I'm not gonna get into that. You guys.
We have a
You.
real life
No, you
example.
got the
Roll
job.
that beautiful bean footage.
You wanna
We can
roll
show you
back?
what happened last week. It wasn't the ECG close, but it was the little ear that got a little singed.
Really?
Oh.
with the cautery and alcohol, like handheld cautery and alcohol. I was like, oh, that's really bad.
Oh, it's on fire!
I mean, I've got all kinds of things.
I wasn't that young.